Hi, I'm Megan McMaster, and this is my video on eye functions, structures, and diseases. So the basic structures of the eye, they include the lens, iris, cornea, pupil, the retina, the choroid, sclera, optic nerve, macula, the vitreous humor, and the aqueous humor, the iris, and the ciliary body, and also the conjunctiva, which is, and so the outer layer of the eye includes the iris, the choroid, and the ciliary body. These are the structures that make up the uvea tract. Having a histological understanding of these layers of the eye wall is essential to appreciate the disease pathophysiology and understanding the various measures utilized for treatment and their therapeutic effects. One of the ways that the ophthalmologists will kind of have a mental checklist to begin the assessment for eye health includes PERLA, and this is pupils equal, round, reactive, light, and lastly, accommodation. Using this checklist is not a diagnostic checklist. It just helps for any implications for further testing. If the pupils are not equal, it's usually harmless unless the eye does not react to light. If a majority of people have equal pupils, and if they are unequal, it is diagnosed as anisocoria. Each pupil should be equal, perfect circles, nice and round. They should be reactive to light. The muscles of the iris open and close the pupil when they respond to light. Pupils, when dilated, should expand this when dimmer lights are on. When brighter lights are used, either in a pen light or walking into a bright room, they'll constrict and they'll become smaller. Pupils, when they react to the light, can be used with a pen light or a swinging light test, where an object will be back and forth in front of the patient and they will have to follow it, and not follow it, but the light will go and you'll watch as the pupils will react. Lastly is accommodation, and it's similar to the reaction of light, but using an object. So when an object becomes closer to the person, the pupils should constrict and become smaller, similar to the light being brighter. So the basic structures, we'll start with the lens, which is right there. And the lens is located right behind the iris, and it's connected to the ciliary body by the suspensory ligament. The lens will bend light rays for them to transfer into the retina. The conjunctiva is a mucous membrane that lies on the inner part of the eyelids and covers the front of the eyes. The main responsibility of the conjunctiva is the protection and lubrication of the eye. It helps produce the mucus and tears. Next is the pupil, which is the black circle that lies right in the middle of the iris. It's a structure that regulates the flow of light that passes through to the retina. The muscles of the iris, as stated earlier, will help constrict the pupil when exposed to bright lights and dilate when it's darker or dim lighting. The iris that's located between the cornea and the lens, it controls the amount of light that's allowed into the eye. The pupil lies within the iris, and it's the pigmented muscular structure that is the most visible area of the eye. In the diagram, I chose blue. The cornea is the clear outer layer of the front eye. It assists in the controlling and focusing on the light entering the eye, and it helps enable one to see clearly. Next is the retina. The retina is located in the back of the eye. And it transforms the light into electrical signals. For light to reach the retina, the cornea, lens, vitreous, and aqueous humor must remain all clear. Once the light reaches the retina, the photoreceptor cells will be provoked and stimulated. This structure is responsible for most of the light refraction that's necessary for a clear vision. The retina is also part of the central nervous system that derives from the neural tube in utero. Next is the optic nerve, which lies towards the posterior of the eyeball. The optic nerve will transmit the electrical signals from the retina to the brain, helping them recognize those signals as images. Now we will go to the outer layer wall with the choroid. This is the vascular middle layer of the wall of the eyeball, and it's located between the sclera and the retina. The structure contains many blood vessels and brings oxygen and nutrients into the eye. Sclera is a tough white outer layer of the eye, and it's meant for the protection of the eye. It also is the muscles that are involved with the sclera move the eyeball, and they're connected. The muscles involved in moving the eyeball are connected to the sclera. Next is the macula, which lies posterior of the eyeball as well, close to the retina. It's actually a part of the retina. It's located in the back of the eye, and it's primarily responsible for central vision. Most of the color that you'll see in your vision and the fine details of what is seen. There are many high concentrated photoreceptors within this structure of the eye. Next is the two aqueous and vitreous humor. Aqueous humor is the clear, watery type fluid that fills the anterior and posterior chambers of the anterior cavity of the eye. The aqueous humor nourishes and cleanses the lens of the endothelium of the cornea. When the aqueous humor is drained, it's through the scleral veins, and it releases into the body's circulation. When there is excess production or decreased outflow of aqueous humor, intraocular pressure will increase, and it can lead to glaucoma. With the vitreous with a vitreous humor, this is more of a gel-like consistency, and it fills the posterior aspect of the eye. The light that passes through here can be blocked by any non-transparent substance located here and cause issues with eyesight. Next and lastly is the ciliary body. This structure is a part of the wall as well. It's behind the iris and it's part of the uvea. Primarily controls the lens. The ciliary body muscles contract and relax to help focus on the objects closest. The function allows natural responses, reflexes based on the environmental stimuli or other factors that can contribute. It produces the aqueous humor, which flows between the lens and the cornea. The first disease I chose was glaucoma. After learning about glaucoma, especially more in depth today in simulation, I'm glad I chose this disease. Glaucoma is when a group of different conditions within the eye occurs. The damage will happen to the optic nerve. This disease is developed by abnormally high pressure. Aqueous humor is drained through the drainage angles and causes intraocular pressure to be stable. If this drainage angle stops functioning properly, the pressure will increase and the damage will occur to the optic nerve. Early detection and treatment are imperative to help prevent or manage this disease from further complications or further vision loss. There are two types of glaucoma that are consisted of primary open angle and angle closure. Primary open angle is the most common type of glaucoma, but it occurs gradually, not abruptly. It easily can be described by a clogged drain, and those that have been diagnosed we're seeing like tunnel vision. There's no pain or vision loss in the beginning. That's why it is a gradual progression and usually is not caught until vision impairment occurs. There's no, when the pain occurs, it's in and around their eye. They can be nauseous and vomit. The angle closure or closed angle glaucoma occurs when someone's iris is very close to the drainage angle. The iris can prevent and block the drainage angle and lead to pressure buildup. An acute attack can occur when acute attack occurs, it is an eye emergency. An acute angle closure glaucoma attack will cause sudden blurry vision, severe eye pain, headache, throwing up, nauseous, and there'll be either a rainbow or halo around light fixtures. Anti-glaucoma drugs are vital in treatment. When it comes to acute care, the medications are ordered to treat the intraocular pressure. Those that are at higher risk of glaucoma include optic nerve sensitivity to normal eye pressure. Regular eye exams are important to find the early onset of disease or help prevent. One of the key aspects of glaucoma is education in preventing and managing this disease, encouraging for the clients to wear sunglasses, being compliant with their therapy, having adequate nutrition, wearing eyewear when doing hazardous activities, or working at a hazardous job site just to prevent any extra impairments or injury to the eye. Those that are most susceptible to this disease are African Americans and those in the aging process, the elderly population. Increased risks with the elderly are due to systemic illnesses and their polypharmacy. Vision impairment, like I said, is a part of the aging process. So those greater than 65 years old should have an eye exam every 1 to 2 years, depending on their current vision state and other health issues that could cause vision impairment. Contraindications of this disease are more common with the elderly due to their systemic illnesses, chronic diseases, and polypharmacy. The contraindications include cardiac issues such as heart failure, tachycardia, hypertension, rheumatoid arthritis, osmolar agents, beta adrenergic agents, asthma, and COPD are several other contraindications. Once the disease process has begun, treatment and regular checkups will assist in slowing down or preventing permanent vision loss. When treating this disease, intraocular pressure is lowered. Unfortunately, the damage that has already occurred cannot be restored and it is permanent. That is why it is vital for eye exams, proper nutrition, and education. Common goals for these patients include no progression of the disease, compliance with their therapy, and if they do have to have a surgical procedure, no post-op complications. The education that's important for this disease is, furthermore, is having adequate nutrition and maintaining health care just in case they need the health insurance and the extra resources to provide what's necessary. And nutrition is vital in all eye health, as you'll hear from the next two that I will be talking about. The next is macular degeneration. This is a common eye disorder in those over the age of 50, and it causes blurred vision or loss-reduced central vision due to thinning of the macula. The macula is part of the eye that's primarily responsible for cleared vision in the direct line of sight. Age-related macular degeneration, AMD, is losing central vision. The person will not see fine details, either near or far. Meanwhile, the peripheral vision will remain intact. AMD is the leading cause of vision loss to those over the age of 50. The majority of those that have been diagnosed are usually diagnosed with dry AMD. Parts of the macula are thinned with age and small clumps of the protein will grow, causing the impairments. Currently, there's no treatment for dry AMD. Certain vitamins and minerals are known to have helped benefit symptoms. Vitamin C, vitamin E, zinc, copper. A healthy diet, including dark leafy greens, yellow fruits and veggies, and fish, all assist in those symptoms. As for the other, wet AMD, this is more serious but less common. New and abnormal blood vessels will form under the retina. Vision loss can occur more rapidly in this disease compared to dry, and those diagnosed with wet usually do not realize it until it is too late and they have blurred vision. Medications to treat wet AMD are anti-VEGF drugs. These drugs help reduce the number of abnormal vessels forming. They also reduce the leakage from these blood vessels and slow that down. Those that are at risk usually have a family history of AMD. They smoke tobacco. They are Caucasian of race. They are eating a high saturated fat diet. They have high cholesterol, obesity, heart disease, hypertension, and over 50 years old. As stated earlier, the importance of nutrition and exams are vital in prevention and early detection. During an eye exam, the ophthalmologist can ask you to look at an Amsler grid, and this will help you notice any blurry, distorted, or blank spots that are going to be in your field of vision. Some other types of tests that can occur are dilating eye drops, optical coherence tomography, and optical coherence tomography and angiography. Lastly, I have uveitis. Uveitis is an inflammation of the uvea and threatens one's sight. The intraocular inflammation can occur from many causes, but tends to affect those working-aged individuals. Autoimmune or inflammatory diseases, infections, adverse reactions to medications, an eye injury, or different various causes of this disease. To be diagnosed, an eye specialist will conduct a thorough, complete eye assessment, and depending on the diagnosis, it can be either an infectious or non-infectious. The uvea is the middle layer of the eye, and it contains most of the eye's blood vessels. The symptoms tend to come on abruptly and can become worse more rapidly. The eye will be red, there can be blurred vision, pain. If this becomes a chronic, this disease can lead to vision loss. When untreated, glaucoma, retinal swelling or scarring, the optic nerve can become damaged, cataracts, or permanent vision loss. This type of disease is the fifth most common cause of several visual losses in the developed world. For treatment in the infectious uveitis, targeting the pathogens is the primary step for the treatment process. If infected, the antibiotics will be prescribed to aid in the treatment. When treating non-infectious uveitis, systemic corticosteroids will be the first line of defense. There are topical, periocular injection, or systemic routes, either oral, intramuscular, or IV. Nurses can manage patients with this disease by using medications to reduce the inflammation. Medications like eye drops will help dilate the pupil and help control spasms. Overall, these diseases treated by understanding underlying conditions and treat accordingly.